Thank you, Governor. Such important messages for you to be able to stay safe and to reach out for support. Please heed those messages and know that there are services available to people. So to those of you who are still watching, because you haven't left to go call your banker or to email Commerce PPP program, good afternoon. I also want to thank the leaders of the Rhode Island COVID-19 Testing and Validation Task Force that the Governor referenced. Particular thanks to colleagues Dr. Angie Caliendo and Dr. Jake Curtis for co-chairing the group. You will be getting a lot of support from clinicians and laboratory experts in state government and outside of state government as well. The focus of this task force is going to be support for our work to expand testing in those communities that are being hit the hardest right now. There are ways, a number of ways that we will be able to do this, and we want to do it as strategically and as science-driven as possible. As the Governor was saying, the ways to do it include a current diagnostic test that we're doing, which we are calling PCR testing, or it could be the serology or antibody testing. Oftentimes, a combination of both allows us to be most effective in understanding the best way to assist. Having this information will inform our work at the state level and will help us identify people who are positive in some of our hardest hit communities before spread occurs, so that we can do our best to really address that in advance. This is a general public health principle we are applying here of focusing resources where the health issue is most acute, where it's most needed, with the understanding that this is what will have the greatest benefit for those communities and for the state as a whole. Our health as a state depends on all of our communities being as healthy as possible. In terms of the numbers for today, as the Governor may have mentioned, we have 437 new cases for a total of 6,699 cases. Sadly, we also have 13 new fatalities. 2 of these people were in their 50s, 1 person was in their 60s, 5 people were in their 70s, 3 people were in their 80s, and 2 people were in their 90s. It's important to be able to extend our deepest condolences to those families of the people who have passed away. As always, we have updated, detailed information posted on our data dashboard on the Rhode Island Department of Health website for all of our COVID-19 cases. We also have the case information posted online by zip code today. This is something that we have spoken of, and I shared that our team is working extremely hard to get that data to you. It is available, and we will be continuing to provide additional details as we go forward. I want to give a huge thank you to our data team at the Rhode Island Department of Health. There are teams of people who have been working to get more and more data online to help us understand how COVID-19 is impacting communities throughout the state. And there are teams of people across state government who have been working together on helping to make this happen. So a thank you to all. We know from the city and town data that we have online that we are seeing higher numbers in certain cities. We now see on a map that will be posted online that certain zip codes in Providence and Pawtucket, for example, are the places where we are seeing even greater concentrations of cases. As the Governor has been saying, and as I've been saying, it is critical that we get the testing and support services into the communities where we are seeing the most cases. Another example of such a testing site, in addition to what was shared earlier, is the Comprehensive Community Action Program's Cranston Health Center at 1090 Cranston Street. The Comprehensive Community Action Program, or CCAP, is one of the organizations in our health equity zones infrastructure, which, as I've described in the last few days, is working in communities on the front lines throughout the state to help narrow health disparities and make sure that everyone has an equal opportunity to be healthy. This is our goal, giving all Rhode Islanders in every zip code throughout the state an equal opportunity to be healthy and to live in the healthiest community they can live in. This new site in Cranston is a drive-through site, meaning that people are being tested in their cars. This site is running Monday through Friday now, but will expand as needed. To get tested there, you need to call and make an appointment. And to make an appointment, you can call 401-943-1981. When you call, you're going to get connected to a healthcare provider, and that healthcare provider is going to talk to you about your symptoms. This is a good moment for me to remind everyone that people should be tested if they have symptoms. That is when testing is most accurate and effective, and it's what we want to encourage for anyone with symptoms. Remember to just call your healthcare provider or call an urgent care center and get connected to the nearest testing site that's available to you. And as we've been saying, we're working to get more and more opportunities into the communities, particularly those that have been most impacted. There are some special settings in which we are taking a slightly different approach, a more aggressive approach, such as in our congregate settings, nursing homes, as I've shared previously. But for the vast majority of Rhode Islanders, we want to really continue to extend that message. You should be getting tested if you have symptoms. That's how we're going to continue to expand, understand where people are being impacted, and make sure that you have the resources needed to be able to isolate effectively and to have your direct contacts in your household or who have been around you be able to quarantine. Doing that is the most effective way to help stop the spread of COVID-19. We're doing a good job together, everyone following the stay-at-home order. We have seen that stopping the spread works from that perspective. As we look forward to reopening the economy, we want to make sure that we have those tools in place so that we can continue to be pinpointed and targeted in our ability to continue expanded testing and implement the contact tracing, isolation, and quarantine procedures that we know work. So thank you for helping us get through this together. Continue to hold on as we go forward.